You know that topic most men avoid discussing, even with close friends. Yep, I'm talking about intimate health. Especially after 50, it tends to become a quiet corner of our lives, often brushed aside. But today, I want to have a heart-to-heart with you, because this conversation could truly change the way you feel, live, and age. Let me ask you something honestly. When was the last time you really thought about the health of your penis? Not just in terms of performance, but in terms of hygiene, discomfort, changes, or even unusual sensations? If your answer is I don't remember or never, you're definitely not alone, and that's exactly why we need to talk. You see, as a urologist with decades of experience, I've met hundreds of men who arrived at my clinic only after something went wrong. Pain, erectile difficulties, infections, or worse. And almost every time, they said the same thing. If I had known this earlier, I would have done something about it. The truth is, after 50, your intimate health requires just as much attention as your heart, your blood pressure, or your prostate. There's a dangerous myth out there that once a man reaches a certain age, taking care of that part of the body is no longer necessary, especially if he's not sexually active. But that couldn't be further from the truth. Your sexual health is part of your overall health. It's about comfort, confidence, hygiene, and even disease prevention. Ignoring it doesn't make the risks go away. It only makes them worse. And yes, I get it. There's discomfort, fear, even shame sometimes. We grew up in a world where men were taught to man up and keep it all inside. But let me tell you, real strength is in taking responsibility for your body. It's in seeking knowledge and making choices that protect your dignity and well-being. So today, I want to walk you through 6 essential habits that every man over 50 should adopt to protect and preserve intimate health. These aren't complicated medical routines. They're simple, practical steps, things you can start doing right now at home. And I promise they can make a world of difference. Because problems like erectile dysfunction, infections, irritation, and even cancer often begin with small signs we tend to ignore. But when caught early, most of them are treatable, or even preventable. We'll talk about proper hygiene. Yes, there is a right and wrong way to wash down there. We'll cover skin changes that should never be ignored, and I'll explain why. Annual checkups are not just about the prostate. We'll dive into common infections and what you can do to reduce your risk. And we'll talk honestly about sex, testosterone, and the emotional toll that intimate problems can bring. You might be thinking, but I feel fine, I've never had an issue. That's great. But prevention isn't about waiting for something to go wrong. It's about staying ahead of it. It's about honoring your body at every stage of life. Because let me tell you, aging with vitality is possible, and it starts with awareness and care. This isn't about shaming or scaring anyone. It's about giving you tools. When you understand what's normal and what's not, what's safe and what's risky, you become your own best ally. You stop guessing and start acting. And that's when confidence returns, not just in the bedroom, but in your everyday life. So grab a seat, take a deep breath, and let's talk openly. You deserve to feel good, to feel whole, and to feel respected in your own skin. Your health doesn't stop at your waist. It includes every part of you. Let's make sure you're taking care of it all. Let's start with the first essential habit, proper hygiene. Now, this might sound obvious, but you'd be surprised how many men neglect this step or do it incorrectly. The skin around the penis, especially under the foreskin if you're uncircumcised, is sensitive and prone to irritation, infections, and buildup of smegma, which is a natural secretion that can become harmful if not cleaned regularly. A gentle wash with warm water and mild soap once a day is enough. Avoid harsh soaps, strong perfumes, or scrubbing too aggressively. This can actually cause micro-injuries and disrupt the natural balance of bacteria that protect you. Next up, regular self-examination. Just like women are taught to check their breasts for lumps or changes, men should examine their genitals monthly. Look for any unusual swelling, discoloration, sores, or growths. It might feel strange at first, but this simple practice can be life-saving. Some cancers of the penis or testicles can be caught early this way. Don't wait for pain. Many serious conditions start silently. If you see something that doesn't look right, don't ignore it. Write it down, take a picture if needed, and bring it to your next doctor's visit. The third habit, protect your blood flow. Erections aren't just about arousal, they're about circulation. And after 50, that circulation can be compromised by things like high blood pressure, diabetes, smoking, or sedentary lifestyle. What helps? Staying active, keeping a healthy weight, managing your cholesterol, and quitting smoking if you haven't already. The health of your blood vessels directly affects your sexual function. Remember, a healthy penis depends on a healthy heart. Now let's talk about infections. It's a myth that only sexually active men need to worry about them. Infections like balanitis, inflammation of the head of the penis, urinary tract, infections or fungal problems can affect anyone, especially if hygiene is poor or if the immune system is weaker with age. Redness, itching, pain during urination, or an unusual smell are all warning signs. And yes, older adults can still contract STIs if they're sexually active, so condom use remains important, even after 50. Another critical point is skin care. The skin of the penis can develop conditions like lichen sclerosis, which causes tightening and discoloration, or even precancerous lesions. If you notice white patches, thickened skin, or persistent redness that doesn't go away, you need to see a urologist or dermatologist. Many men delay treatment because they feel embarrassed, but early intervention often means less invasive treatment and better outcomes. Let's not forget hormones. Testosterone naturally declines with age, and that can affect libido, energy, mood, and even erections. But here's the thing. Low testosterone isn't just about feeling tired or having less interest in sex. It can also be linked to diabetes, osteoporosis, and depression. If you're feeling off and can't explain why, get your levels checked. Hormone therapy isn't for everyone, but knowing where you stand is a powerful first step. Stress is another major factor. Chronic stress increases cortisol, a hormone that interferes with testosterone and sexual function. Many men think stress only affects the mind, but it takes a serious toll on the body too, especially on your sexual health. Finding ways to relax, whether through exercise, meditation, hobbies, or therapy, isn't just good for your mood. It's good for your erection, your relationships, and your heart. You should also be aware of medications. Some drugs used for blood pressure, depression, or prostate issues can affect sexual performance. Don't stop any meds on your own. But if you've noticed changes in your function since starting a new treatment, talk to your doctor. There may be alternatives or adjustments that can help. Your comfort and quality of life matter. Routine checkups are essential too. Many men see a doctor only when something is wrong, but regular visits, at least once a year, can catch silent problems early. That includes prostate exams, blood sugar checks, and evaluations for any changes in urinary or sexual function. Prevention is always better than dealing with complications down the line. Lastly, don't underestimate emotional health. Shame, insecurity, or relationship stress can all manifest physically. If you're dealing with performance anxiety, low self-esteem, or lingering guilt from past experiences, it's okay to ask for help. Talking to a therapist or counselor isn't a sign of weakness. It's a sign of courage. Intimacy isn't just physical. It's deeply emotional, and healing both aspects can transform your life. Let's take a moment to talk specifically about erectile dysfunction. It's more common than most men think, especially after 50. In fact, studies show that nearly half of men between 50 and 70 experience some level of difficulty in achieving or maintaining an erection. And yet, many suffer in silence. It's often seen as a sign of weakness or aging, but the truth is, erectile dysfunction is usually a symptom of something deeper: poor circulation, hormonal imbalance, nerve issues, or even psychological stress. It's not something to be ashamed of. It's something to investigate. You see, the penis is like a window into your vascular health. If blood isn't flowing well enough to support an erection, it might not be flowing well enough elsewhere, like your heart or brain. That's why I always tell my patients, if you're having trouble down there, don't just reach for a quick fix like a pill. Let's look at the bigger picture. What's going on with your diet, your sleep, your stress levels, your blood pressure? Addressing the root causes brings not just better intimacy, but better life expectancy too. Speaking of diet, let me be clear. What you eat directly impacts your sexual health. Diets rich in fruits, vegetables, whole grains, and healthy fats improve blood flow and hormone production. Meanwhile, diets full of processed foods, sugar, and trans fats can impair vascular function and reduce testosterone. Think of every meal as fuel, not just for your body, but for your confidence and vitality. Small changes, like adding leafy greens or cutting back on alcohol, can make a noticeable difference. Another issue I often see is neglect of hydration. It sounds basic, but dehydration affects everything from energy levels to skin health, and yes, to sexual function. Your body needs water to produce key hormones and keep tissues elastic and healthy. Aim for around 2 liters per day, more if you're active or live in a hot climate. If your urine is consistently dark yellow, it's time to drink up. It's a simple habit that pays off in so many ways. Let's address an uncomfortable but necessary topic: penile pain. Whether it's during sex, urination, or even while at rest, pain should never be ignored. It could be a sign of infection, inflammation, Peyronie's disease, a condition where scar tissue causes curvature, or even a neurological issue. Don't wait for it to go away on its own. Pain is your body's way of asking for attention, and in this case, early diagnosis is key to preventing long-term issues. A lot of men also experience urinary changes as they age, like frequent nighttime trips to the bathroom, weaker stream, or the feeling that they can't fully empty the bladder. These symptoms could be linked to benign prostatic hyperplasia, BPH, a non-cancerous enlargement of the prostate. While common, it shouldn't be brushed off. There are medications, lifestyle adjustments, and in some cases, procedures that can help. The earlier you get evaluated, the better your options. Let's circle back to self-confidence. Many men tell me that once they start experiencing issues, whether it's with erections, urination, or body image, they begin to feel less like themselves. That sense of masculinity or control takes a hit. But I want to remind you, your value doesn't lie in performance. It lies in how you take care of yourself, how you communicate, how you show up. Seeking help is not losing power. It's reclaiming it. There's also the topic of partners. If you're in a relationship, these issues don't exist in isolation. They affect intimacy, communication, and emotional closeness. I encourage couples to talk openly about changes, concerns, and desires. Sometimes partners are more understanding than we expect, and in many cases, working through these challenges together brings people even closer. Don't shut out the people who care about you. Invite them in. One more thing. Masturbation is completely normal, even in older age. It's not something to feel guilty or ashamed about. In fact, it can be a healthy way to explore what feels good, reduce stress, and maintain sexual function. But if it's accompanied by guilt, compulsion, or becomes a substitute for real intimacy, it might be time to talk to a therapist. All things balance and self-awareness are key. Finally, I want to emphasize that these habits are not about chasing youth. They're about aging with intention, about feeling strong in your body and proud of the way you care for it. Every stage of life brings changes, but with the right knowledge, those changes don't have to mean decline. They can mean evolution, deeper connection, and renewed strength. Let's now talk about something that gets overlooked far too often: skin color and texture changes on the penis. I've had patients come in worried about patches, spots, or roughness that they've ignored for months or even years. Sometimes it's benign, like a harmless pigmentation, but other times it's a warning sign of something more serious, like penile cancer, which, although rare, can be devastating if not caught early. If you ever notice persistent discoloration, a lump, or a sore that doesn't heal within 2 weeks, please don't delay. Get it checked. Another underrated tip: wear the right underwear. Sounds trivial, right? but tight, non-breathable underwear can trap moisture and heat, creating a breeding ground for fungal infections and skin irritation. Look for cotton or moisture-wicking fabrics that allow airflow. And if you exercise or sweat a lot during the day, change your underwear before sleeping. This small change can drastically reduce skin problems and discomfort. Let's also talk about the role of pelvic floor muscles. Just like women benefit from Kegel exercises, so do men. Strengthening these muscles can improve bladder control and even enhance erections by supporting blood flow. You don't need special equipment, just a few minutes a day of tightening the muscles you'd use to stop urination midstream. Done regularly, these exercises can build strength and prevent or improve mild incontinence or erectile issues. One area that surprises many men is how dental health connects to sexual health. Yes, really. Poor oral hygiene has been linked to erectile dysfunction. The bacteria from gum disease can enter the bloodstream and affect blood vessels throughout the body, including those that supply the penis. So don't skip your dentist appointments and brush and floss daily. It's not just about your smile, it's about your whole body health. Sleep is another major piece of the puzzle. Sleep deprivation throws off hormone levels, increases stress, and impairs blood vessel function, all of which can affect your sexual performance. Aim for 7 to 8 hours of good quality sleep each night. If you snore heavily or wake up feeling tired, consider getting screened for sleep apnea. It's more common in older men and can seriously disrupt your health without you even realizing it. And then there's alcohol. While a drink or two occasionally is fine, excessive alcohol intake can dull nerve sensitivity, lower testosterone, and even damage the liver, which plays a role in hormone metabolism. If you've noticed a decline in performance and are regularly drinking several drinks a night, that may be a factor. Moderation is key, and your body will thank you for it. Some men ask me about supplements, and yes, some can help, but they're not magic bullets. Zinc, vitamin D, omega-3s, and certain herbal extracts may support hormone production and vascular health, but they should complement, not replace, a healthy lifestyle. Always talk to a doctor before starting anything new, especially if you're on other medications. What works for one person might not be right for another. Let's take a moment for emotional honesty. Many men carry silent fears about aging and sexuality. They may wonder if they're still desirable, still man enough, or still able to connect with a partner the way they used to. These are natural questions, but they're rarely talked about openly, and that silence can feel heavy. If that's you, know that you're not alone. Vulnerability is not weakness, it's the beginning of deeper strength. Support groups and therapy can be life-changing, whether in person or online. Connecting with other men going through similar experiences can remove shame and bring clarity. You start to realize it's not just you, it's part of life, and with the right information and support, you can move through it, not just survive it, but thrive within it. Finally, let's talk about pride. Not the kind that keeps you from asking for help, but the kind that says, I care about my body. I want to be present in my life. I want to age with dignity and power. Every habit we've discussed today is a form of self-respect, a message you send to yourself every day that you matter. And that message is contagious. It affects your energy, your relationships, and your joy. As we begin to wrap up, I want to remind you of something essential. Your body has been with you through every chapter of your life. It's endured stress, celebration, illness, growth, and passion. And even now, it's still speaking to you, sometimes through sensation, sometimes through silence. Are you listening? Are you honoring what it needs in this new stage of your life? Because this is not just about avoiding illness. It's about creating a life you feel proud to live in, a body you can trust, a routine that supports you, and a mindset that allows you to be present, whether you're alone or with someone. These 6 essential habits we've explored: hygiene, self-exam, blood flow, infection prevention, hormone awareness, and emotional support, aren't just urologic tips. They're a roadmap to thriving, not just surviving, after 50. And here's the truth many men don't hear enough. Your sexual health is still relevant. Your pleasure, your comfort, your sense of connection. all of that still matters. You don't have to give up on intimacy or settle for discomfort. You can be proactive, informed, and empowered. The freedom that comes with that is incredible. It's easy to fall into the trap of this is just aging, but decline is not destiny. Your body is capable of healing, adapting, and even improving at any age. But you have to meet it halfway. That means facing discomfort, asking questions, and sometimes having tough conversations with professionals or partners. That courage, that's where transformation begins. If something in this conversation struck a nerve, good. Let it be the reason you make an appointment, start a new habit, or open up to someone close. Change doesn't have to be dramatic to be powerful. It starts in the small, consistent choices you make every day. So here's your call to action. Check in with yourself. Look at your habits. Pay attention to what your body's been trying to tell you. And if you haven't seen a urologist in a while, make that call. It's not just about solving problems. It's about prevention, peace of mind, and taking ownership of your future. Also, talk. Talk to your partner, your doctor, your friends. When we keep these topics in the shadows, we carry them alone. But when we bring them into the light, we create space for support, for healing, and for strength. And if you're feeling overwhelmed by all this, breathe. You don't have to fix everything overnight. Start with one thing. Maybe today it's being more mindful during your shower. Maybe tomorrow it's booking a checkup. These steps build on each other. And over time, they become your new normal. Because at the end of the day, this isn't about fear. It's about the freedom to move without pain, to connect without shame, to age with energy, to love yourself in a way that shows, not just in your words, but in how you treat your own health. You deserve that. Every man does. And I'm here to tell you it's absolutely possible. Let's rewrite the story of aging. Let's make it strong, informed, and intimate. Let's talk about our bodies, our needs, our dignity, without fear. Your health journey is yours to lead. But you don't have to do it alone. With guidance, support, and the willingness to care for yourself from the inside out, you'll go further than you ever imagined. So here's to you, to your courage, your curiosity, and your commitment to living fully. Take care of your body. Honor your manhood. And never stop believing in your own vitality. Disclaimer: this content is for informational and educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of a qualified healthcare provider with any questions you may have regarding a medical condition.